Welcome to our Geisinger Health Plan onboarding orientation. This presentation gives our new provider groups and facilities a high-level overview of Geisinger Health Plan products, education, and resources. Our network is based on quality, efficiency, and cost metrics, which contributes to our highly integrated care delivery system and lowers costs for our members. Thanks again for collaborating with Geisinger Health Plan on this journey. This orientation will cover what products we offer to our members, prior authorization resources, resources available through pharmacy, how we measure quality, information on claim submission and payment, and how to keep your practice information current. As a participating provider, Geisinger Health Plan has several ways to communicate with you, and we encourage you to use these resources. The plan provides unsecured information on our website, geisingerhealthplan.com, and secured member information, in addition to important resources, are available through our provider portal, Availity Essentials. Included on Availity, you will find our participating provider guide. This is a supplement to your contract and your go-to resource. GHP Family Provider Manual, Operations Bulletins, which contain specific subject matter and usually timed action items and forms. Online Updates page, which includes various updates, which can be clinical and clerical related, such as billing. Who to Call, which is a resource with contact information to reach departments such as claims, customer service, medical management, case management, etc. Geisinger Health Plan offers a variety of products to our member population. The following products are the various plans we offer: commercial and marketplace plans, which include HMOs and PPOs. Gold is our Medicare Advantage plan. GHP Family is our medical assistance product, and we provide annual education for those who participate with this line of business, as it is required by DHS. There is a link in the PowerPoint for you to access the annual education. If you're a behavioral health provider, Geisinger Health Plan does not administer behavioral health benefits for our GHP Family members. Per DHS, these benefits are administered by the county's Behavioral Health Managed Care Organization. You can find your county's behavioral health MCOs at dhs.pa.gov. GHP Kids, formerly Children's Health Insurance Program, also known as CHIP. Lastly, third-party administrators, also known as TPAs, for custom self-funded plans. Some of our TPAs and marketplace products have narrowed and/or tiered networks. Keep in mind, all contracts are different. If you are unsure about what individual lines of business you participate with, follow up with your assigned provider engagement liaison. While your provider engagement liaison can always help with product participation questions, you can also check this yourself. To determine your participation status and tiered status, you can search this similar to how members search. Go to geisingerhealthplan.com and click Find a Doctor. Just type in your name in our provider search, which will take you to a screen that looks like the image on this slide. Use the Plans Accepted feature, shown highlighted in yellow, to see a list of plans your group accepts. You can also inquire about your PAR status by contacting the provider care team at the number listed. This section will cover Cigna Healthcare PPO WRAP Network. Geisinger Health Plan, or GHP commercial group and marketplace members, have even greater access to care across the country with a WRAP expanded network provided through our affiliation with Cigna Healthcare. The member's plan type, HMO or PPO, benefit type, and service location may determine how healthcare providers direct claims and requests for prior authorization. Members can be identified by the Cigna Healthcare logo appearing on the front of their member ID card, as shown on the slide. This map shows the GHP network coverage area consists of the county shaded in blue. Contracted providers submitting claims for PPO or HMO members must be submitted accordingly, depending on the provider's service location, being inside GHP coverage area or outside GHP coverage area. The grid listed on the slide outlines which entity providers should submit claims and/or prior authorizations for both medical and pharmacy. Geisinger Health Plan works with several vendors for services that require prior authorizations or pre-certification. As a reminder, prior authorizations, pre-certifications, are the provider's responsibility. Always make sure to verify if a service does or does not require a prior authorization, as the plan does not accept retro authorizations. Check the prior auth list, inclusive of codes requiring authorization at healthhelp.com/Geisinger. This slide also shows the list of vendors that Geisinger Health Plan uses for prior authorization and pre-certifications. Cohere provides a streamlined and collaborative online authorization experience, evidence-based care suggestions, faster approval, and instant authorization in some cases. Authorize the following services through Cohere: home health and hospice, outpatient therapy services, chiropractic services, outpatient services, see prior auth list, including DME, musculoskeletal services, interventional pain management, cardiology services, and inpatient services, including behavioral health and SNF. You must register for Cohere to obtain prior authorizations. Cohere provides online education to guide you through the process. OncoHealth provides authorization for Geisinger Health Plan members' Oncology Benefits Management Program. Prior authorizations requests for all plans are for medical benefit chemotherapeutic drugs and radiation oncology therapy. To request an authorization for Medicare Part B chemotherapy drugs, call OncoHealth at 888-916-2616. Fax them at 800-264-6128 or visit OncoHealth at oneum.oncohealth.us. Lastly, Health Help provides authorization for high-end radiology services. Use the links on this page to take you to the vendor's designated sites. Geisinger Health Plan has partnered with Tomorrow Health to provide patients with more convenient and more affordable access to home medical equipment. Ordering providers must send their orders directly to Tomorrow Health. Tomorrow Health will send orders to best-in-class dermal medical equipment providers in the Geisinger Health Plan network. Tomorrow Health will ensure member orders are clear, concise, and routed to a provider who carries the item needed without delay. Be sure to request authorizations through Tomorrow Health before billing for the supplied DME, as retro authorizations are not accepted. Medical policies are developed to assist providers with administering and understanding the provision of benefits. Medical policies are available on our website at the link on this slide. For questions about Geisinger Health Plan medical policies, email or call us using the contact information provided. For prescriptions, a formulary lookup tool is available on Availity. For prescriptions requiring prior authorization or exception, you may submit requests online through Prompt PA. Complete the Prompt PA prior authorization form or contact Geisinger Health Plan Pharmacy Department by phone at 800-988-4861. HEDIS is a collection of standardized performance measures developed by NCQA, which allow direct, objective comparison of quality across health plans. Geisinger Health Plan has two HEDIS quality-based incentive programs, PQS and P4Q, for our contracted primary care providers. Details are outlined in the individual program manual, which you can find on Navinet. If you are an eligible provider group, your provider engagement liaison will reach out with more detailed information. Our Anticipatory Management Program, also commonly referred to as AMP, is a tool created to help primary care providers address and manage chronic conditions for our Gold members' Medicare population. Using the AMP tool through Availity under payer spaces supports clinical decision-making with insight into untreated chronic conditions, transparency into diagnoses by other providers, and helps identify relevant gaps in care. Our ask of you is to use the AMP for every Gold member visit during the calendar year by printing the AMP report for each visit, no more than 14 days prior. Use the information to validate, address, and capture all current conditions. Then, simply submit a claim for corresponding visit with proper coding that addresses the condition in the report. There are 3 steps in the claims process for Geisinger Health Plan. The first is to submit claims through the electronic data interchange. You'll work with your vendor to submit claims through one of our approved clearinghouses. Step 2 is for payment. providers are to register with InstaMed. Payments through InstaMed will be directly deposited, as Geisinger Health Plan does not issue paper checks. The third step is your explanation of payment, also known as your claim remittance, which will be available online through InstaMed as well. You can find information about these e-transactions at geisingerhealthplan.com. Recently, Geisinger Health Plan moved their provider portal from Navinet to Availity Essentials. Providers who don't use a clearinghouse and file paper claims now have the capability to submit electronic claims and can file those claims directly online through the Availity Essentials portal. Updates to provider capabilities in Availity Essentials will be ongoing in early 2026. Check the GHP Provider Updates page regularly or email communications from Availity for announcements. Direct any Availity questions to Availity at 800-282-4548. For claim submission to Geisinger Health Plan, providers are to use standard CMS 1500 or UB04 formats. Claim submission is preferred electronically, and all fields and data elements are required. You can find a current listing of this information, including electronic formatting, under Claims and e-Transactions at geisingerhealthplan.org. If you are unable to submit electronically, you may use a paper claim. Include all data element fields and mail it to the address listed. NPI numbers and taxonomy at the individual, facility, and organizational level are always required. Providers must adhere to the timely filing guidelines for claim submissions. Geisinger Health Plan must receive all claims within 120 days of the date of service. Any resubmissions to add or correct data must be received within 60 days from the date of the initial EOP. The only exception to this rule is for GHP Family, our MA product. The requirement for GHP Family is that all claims must be received within 180 days of the date of service, and resubmissions to add or correct data must be received within 365 days from the date of service. Remember that CHIP claim submissions fall under the 120-day initial submission, 60-day resubmission guideline. Geisinger Health Plan collaborates with vendors such as Lyric, also known as Change Healthcare, Avalon, Zealous, Cotivity, and other payment accuracy and claim editing solutions to perform claim edits. The plan does have several claim edits in place, and while CMS and other payers may audit on the back end, we audit on the front end, which often requires documentation. Enhanced claim edits will be applied to a variety of care services across the spectrum of your Geisinger Health Plan patients' health benefits. Our edits are based on national standards of care, national and regional regulatory guidance, national correct coding standards, and areas that have been identified as problematic and commonly misbilled. Helping you with billing accuracy and enhancing the integrity of Geisinger Health Plan claims processing is always top of mind. Whether it's routine testing or any other type of patient service, making sure you bill correctly is always the best way to reduce denials, so your claims are adjudicated in a timely, accurate manner. If you wish to appeal a claim, all appeals may be submitted electronically through Navinet or by using the Claim Research Request form. We refer to these forms and the appeal process as CRIFs. Remember that CRIFs must be received within 60 days from the date on the EOP. This slide outlines when and when not to use a CRIF. An example of when to use a CRIF is if no prior auth was obtained. You would need to submit documentation indicating why the prior auth was not obtained. Claim edit denials examples would be incidental or bundled edits, or the modifier 25 rule. Remember, notes are always required. You should not use a CRIF to retract a claim, to add a code to your fee schedule, or correct information on a denied claim. You should submit a replacement claim. When in doubt about the CRIF process, contact your liaison. A replacement claim is billed when a specific claim needs to be entirely replaced with new claim information. This slide provides a list of the do's and don'ts for replacement claim billing as a guideline. We do enforce this rule. Note that when a replacement claim is billed, the original claim is null and void, which can result in retractions. The provider care team is a dedicated team set up to answer only provider questions and should be your first line of contact at Geisinger Health Plan, These specially trained agents can assist with all your claim questions, as well as benefits and eligibility. You can contact the Provider Care Team at 844-447-7768 and follow the prompts on this slide for your desired inquiry. Geisinger Health Plan coordinates benefits for all lines of business. However, for GHP family, providers must adhere to additional guidelines. This includes always ensuring GHP family submissions receive encounter data for all covered services, even when GHP family is payer of last resort and no additional payment is expected. Also, including preventive pediatric care, early and periodic screening, diagnostic, and treatment services to children. As a reminder, providers cannot balance bill these members. Keeping your practice information current allows us to best serve our members. Provider data accuracy allows members to find you as a participating provider or facility and ensures you receive important communications and that your claims get paid. You may use our provider search feature covered in an earlier slide to view your current information. If you need to make any changes to your office, add or remove a practitioner, or make other changes to your profile, you may submit those changes using the Practice Information Change Form. Also, as part of the Consolidated Appropriations Act, and to improve the accuracy of provider directory information, group health plans and health insurance issuers offering group and/or individual health insurance coverage are required to validate information included in provider directories at least every 90 days. Geisinger Health Plan has partnered with Kairos Health to assist in the collection of this information. In compliance with NCQA requirements, Geisinger Health Plan follows provider office standards to monitor and ensure access to primary, specialty, and behavioral health services. On this slide, you will see the primary care, specialty care, and behavioral health physician scheduling procedures. Note that member wait times for PCPs should not exceed 30 minutes. Providers are also required to conduct outreach whenever a member misses an appointment. The plan conducts annual access reviews to inquire with providers if these standards are being followed for our members. GHP Provider Engagement Team will provide annual education to all GHP family providers. The annual training items listed on this slide are on our GHP family page. This slide highlights our Special Needs Program and Dual Special Needs Plan. DSNP members are eligible for both Medicare and Medicaid. The Centers for Medicare and Medicaid Services, developed by the Special Needs Program concept to be sure that the special needs of Medicare Advantage members are being satisfied. Special Needs Plan Model of Care training is available by following the link on this slide. Social drivers of health are conditions in the environment where people are born, live, learn, work, play, and age. A person's overall health and quality of life outcomes and risks are directly connected to the conditions they live in, such as having clean water and air. Health-related social needs are those that have a direct impact on people's health outcomes and how much they use healthcare. When social needs screenings become part of the routine patient care intake process, it makes identifying these needs easier. Geisinger Health Plan's Neighborly Resource Platform provides the social needs screening as well as a user-friendly way to connect patients to needed social services. You can access additional information regarding social drivers of health by following the link on this slide. For the past decade, Geisinger Health Plan has built a social care network to make it easier to find resources and connect them with the member. The plan adopted Neighborly and continues to add resources that meet the needs of those seeking services. These services are either low cost or free, depending on the member's circumstances. Neighborly houses several resources that include food, housing, and transportation, as well as financial and legal services. Anyone can access the Neighborly platform, and resource materials are also available in 10 different languages. This slide offers more information about Neighborly and training sessions. We would also like to offer an opportunity for any participating provider to join our Health Education Advisory Committee. This group meets virtually, per Medicaid zone, for our GHP family members twice a year, in April and October. It allows members and network providers to share in open conversations about health plan services. It also offers a space for members to express their ideas, give feedback, ask questions, and collaborate with community providers and Geisinger team members. For more information about the committee and how to join, call the number listed on this slide. Fraud, waste, and abuse contributes to inflated premiums and loss of revenue, and is theft, which is illegal. Geisinger Health Plan wants to do our part in preventing these activities. Let's review some examples to better understand how to prevent and report these incidents. An example of fraud is billing for services that were not provided. An example of waste is providing services that are not medically necessary. An example of abuse is misuse of codes or billing for a non-covered service. An example of oversight laws and regulations is the OIG exclusion list that prohibits debarred entities from providing services in a federal healthcare program. A False Claims Act violation is submitting for a service that was never performed. Anyone who initiates a false claim case is protected from suspension, threats, or harassment in terms of their employment. Some other laws include Stark Law and HIPAA. Fraud, waste, and abuse should be reported directly to the DHS Provider Compliance Hotline, as noted on the slide. All leads are kept confidential. Member appeals, provider disputes, and detailed information can be found in the GHP Family Provider Manual and GHP Family Member Handbook. Remember to register with Availity Essentials and choose Geisinger as the health plan in the drop-down. It is important to create individual logins for all who use this tool within your provider group or office. Availity Essentials and Geisinger Health Plan strongly advise the use of individual logins for security purposes and ensures you are complying with HIPAA regulations. Providers without a clearinghouse can now submit electronically using Availity Essentials. Work with your vendor or clearinghouse to submit through EDI. As an additional reminder, remember to register for Health Help, Cohere, and/or Tomorrow Health, depending on the type of services you order or perform. Lastly, sign up with Instamed to begin receiving payments. Thanks for participating with Geisinger Health Plan. We value your service to our members.